Hi, good evening, everyone. Thanks for attending our webinar. Hope you all had a wonderful holiday. Missed you guys. So tonight we're going to talk about intimacy and the ostomate. Should you have any questions, hold them till the end, and you can certainly put them in the Q&A section on the Zoom. And at the end, we'll talk about them and read your questions, and I can answer them for you. And so let's get started. Next slide. All right, so sex and intimacy are very important to our well-being, physical and emotional. And we all seek to feel desirable and to be loved. So this does not change after having ostomy surgery. It includes feelings, the relationship challenges that face ostomates, face those without stomas as well. And those include feelings of insecurity, how we feel about our bodies, which is also known as body image. And so extra things that ostomates are concerned about, besides the normal things, are how will the ostomy affect my sex life? Or will wearing a pouch impact my sexual activity? Or things like, will my partner reject me? So those are big concerns for anybody with a stoma. And so hopefully in listening to this webinar, you may come up with some ideas. I'd like to give those to you to help ease into that. Now, next slide. So it's much easier to hide your stoma when you're wearing clothes. You can lead a normal life and nobody knows you have the stoma. But thinking about removing your clothing during an intimate encounter can be quite daunting. And so the challenges of self-confidence become upmost in your mind. Those with stomas can lead normal, happy, and fulfilling love lives and relationships after surgery. Next slide. Whether you have an ostomy or not, everybody experiences sexual difficulties at some point in their lives. Most of us, with or without a stoma, have body insecurities, but it's important to remember you're the same person on the inside, in your heart and in your mind, as you were prior to having surgery. Your body is just a little bit different. Next slide. So if you've had a partner through your illness and your ostomy surgery, before resuming intimacy, it's important to talk with them about your concerns. Most likely they have concerns as well. If you're single and are meeting people, I'm sure you're wondering how to bring up the topic of you having a stoma. You certainly want to do that before your relationship becomes intimate. So it's a good idea, if your relationship is becoming serious, to discuss or bringing up the topic of having a stoma, why you have a stoma, your sickness, your illness, and how you ended up in this situation. I know it sounds easy to do, but it can cause anxiety. So talk about the seriousness of how sick you were, and give them time to digest that. Once they can absorb all of that, if they really care about you, they're going to be grateful that you're alive. Next slide. So strengthening your intimate relationship, talking with your partner, is a must. Most people out there, especially if you're meeting somebody new and you've decided now to have an intimate relationship with them, they may not understand what a stoma is. So you do want to talk with them about that. Let them know how it can affect your sexual function, and provide your partner with that education about the stoma, so it eases their fears along with your own, because they may be worried that they can hurt your stoma, damage you in some way, shape, or form. So you do want to talk about that and let them know what it's all about. You also want to talk about physical limitations. You may have difficulty as a man with erection, and for a woman, vaginal dryness from having surgery. You can have pain with intercourse. Your fears of rejection, your maybe your pouch, you're worried about it leaking, removing your clothing, again, that's a huge fear, and whether or not you can perform. So, and you also want to talk about your expectations and what your partner's expectations are during that encounter. So talk about all of this ahead of time. The other things you should bring up as well are sexual activity, what you like and what you don't like. Now, your likes may change once you have a stoma, so you want to really think about that. And then again, there's emotions that will interfere with sexual desire. So things like feeling guilty, feeling resentment, being angry. Sometimes you can have a loss of libido and not be interested in sex. And those are common things that can be related to the type of surgery that you've had. So once you're ready to resume sexual activity, you know, there are some ideas or tips that you may want to consider. So remember, though, that resuming your sexual activity, there is no set time to do that. It's going to be dependent on how you feel. If you had surgery fairly recently, you know, having sex is not something that you're really going to be thinking about. So recovery takes time. So you want to allow your body to have that time to heal. And you want to get good or very confident in managing your stoma and your pouching system before you start those intimate encounters. So again, now your tips. Your first encounter might not be perfect. It's going to be something new for you and your partner. So I want you to keep in mind that surgery in the pelvis can cause changes, some temporary, some permanent. The reasons that you needed to have ostomy surgery are a huge factor in what your changes are going to be. So if you've had a cancer, a rectal cancer, bladder cancer, or Crohn's disease, your outcomes are going to be different depending on the reason for your surgery. For instance, surgery for a cancer, let's just say rectal cancer, they're doing surgery down low in the pelvis. It requires the surgeon to remove a lot of tissue in that area that's low in the pelvis. And that can damage the nerves and the blood vessels that control certain aspects of sexual activity. Whereas if you've had a surgery and end up with an ostomy for Crohn's or ulcerative colitis, it's a little more tissue sparing. So less tissue, less damage to blood vessels and nearby structures. So things may remain intact and you might not have any issues with sexual function. Now, physical changes after surgery. I apologize, I just went through all of that. Next slide. So changes for women. Now, some surgeries down low in the pelvis will affect sexual function. And if they're removing part of the colon or the rectum, the uterus can shift. So with that shift, it may cause pain with intercourse. So you may find that having intimate encounter, if you're lying on your back, it may be more painful. You may have less pain if you happen to be in the upper position. That will help you with the pain. Nerve pathways can remain impaired, may be impaired during surgery, which can lead to decreased sensation and inability to climax. So again, that's something that you would have to, you'll find out as you become intimate and have more than one encounter. You can be referred or seek an evaluation through a pelvic floor physical therapist. That will help quite a bit and may solve your issues. Also, vaginal dryness. That can be very common with surgery. It can be common with medications that you take, and also just with the aging process. So there's lubricating agents out there that will help if you have this particular problem. If you have rectal cancer or even vaginal or cervical cancer and you undergo radiation therapy, radiation can cause some stricturing and stenosis in the vaginal canal. And that would mean it's difficult often to have relations. So they do make dilators that can help stretch that area if things are too tight. They come in packs that vary in sizes. They start out very small, and directions are in the package on how to use them. But that can very well help and make things much better for you. Now, contraception for women. If you have an ileostomy, birth control pills are not a good option. Things travel through your digestive system a little too fast, and you may not get the full response from the birth control pills. So not a good selection for ileostomies. If you have a colostomy that's on the left side, birth control pills are most likely fine for you. As far as IUDs, diaphragms, or cervical caps, you do have to keep in mind that with surgery, if your uterus has shifted, changes in the anatomy of the vagina can make those products inappropriate and ineffective for you. So you may want to look at that. Hormone injections or hormone patches are a great option for those with ileostomies. It's a little bit more appropriate, so you don't have to worry about the birth control pills. Condoms, certainly a very good option. They also protect against STD. So if you're with new partners, consider that option. And then again, if you're young and you're starting a family, having a stoma does not mean that you can't have children and that you can't have a vaginal delivery. So all of that can work out just normal. And that, again, is going to depend on the type of surgery that you've had and why you've had that surgery. Now, changes for men. As I mentioned previously, if you're having a surgery where a lot more tissue is involved, the risk of damage to those nerves that stimulate erection and ejaculation during surgery can create this problem for you. The nerve pathways run very close to the rectum, and again, damage can be temporary or permanent. Now, the ability to get and sustain an erection is called impotence. And you need to keep in mind that it's not uncommon to have a problem of impotence after surgery because of the nerve damage. Nerves take a long time to regenerate, and we're talking up to a year. So you may have this problem temporarily, but it may resolve as nerves regenerate. There are specialized surgical treatments available should this problem become permanent for you. And I would suggest that you seek an evaluation with the urologist who can determine what are the right or appropriate therapies that can be effective for you. Now, intimate apparel, there's stuff available for men and women both. Ostomy Secrets has many options for men. A wrap is pretty common or a good option. It will hold that ostomy pouch close to your body. I did recently find a company called Sill. It's made out of Italy or made in Italy. And they offer a belt, which is great. It's similar to the Stealth belt. It is made of material that wicks away moisture, and it's nice. It fits nice, so you might want to look into that. And then if you go to Etsy on the computer, there's multiple options that you can find there for men as well. Now, for women, again, Ostomy Secrets has lacy wraps. They have lacy underwear. Sill as well has nice wraps. Etsy has many products as well. And I did find a nice company called Unspoken, Unspoken Rosebud. I've only found their products on Etsy. They do have a Facebook page as well. So if you're looking for something like that, feel free to look at all of those options. Now, I'd like to end this presentation by saying that changes that affect your sex life after surgery can be very frustrating and upsetting, but you are special, and sexuality is only one part of who you are. So take your time and don't let having an ostomy hold you back. So thank you very much. If anybody has any questions, again, you can put it in the question and answer section, and I'll be happy to answer those for you. Now, I had previously done this webinar in years past, about a year or so ago. I did update it a little bit in the hopes of adding additional information in case there's some repeat followers here in the audience today. So Linda, have we had any questions?
There's no questions yet, Christine.
Hey, thank you.
You're welcome.
And I figured this topic was quite appropriate with Valentine's Day coming. So some of you may have some of these concerns. I apologize, I'm just getting over a cold. And I did put my email, also Linda put her email in the chat room in case you have questions that pop up after this webinar is over. You can feel free to email myself or Linda, and we can get those questions answered for you.
Well, Patty wants to know what we're talking about.
Oh, hi, Patty.
She just
I'm sorry that you missed the discussion. So we're talking about intimacy and ostomies, and the types of things that go through your mind if you are a new ostomate, having a relationship, whether you have a partner who's been with you through your illness versus being single and meeting people, and how to talk to them about having a stoma, and then just how to approach that subject. Based on the type of surgery that you have had, certainly can determine what kind of changes you may have. And this webinar will be published on the Health Products for You YouTube page, so that you can feel free to look at the whole webinar and PowerPoint. And hopefully that will help you through this portion or this type of topic. And feel free to ask additional questions.
We do have a question. There's an anonymous attendee that wants to know what stoma caps are.
So a stoma cap, if you have a colostomy, if you're using actually, I think they're only available now in one piece. So stoma pouches typically are about 7 or 8 inches, unless you're using a midi, which is probably closer to 4 or 5 inches. But a stoma cap has a barrier attached to it, and you would put this on, and the stoma cap is probably only about it's a pouch, it's only about this big. And so it's attached to the barrier. So before you would have your intimate encounter, you could put that on. And this way you don't have a large pouch in the way during your intimacy. So you can find them on most of the websites. Health Products for You has it. Hollister makes them. Coloplast makes them. They are not appropriate for those with ileostomies because you never know when there's going to be output. Ostomies are very unpredictable with their output, where colostomies typically, once you've healed, you've developed a new bowel regimen, and you know when your stoma is going to be active. So a stoma cap is certainly an option for your colostomy.
We do have another question. And she writes, I'm new to this world, but intimacy is the last thing I'm interested in. That is not something I will be dealing with.
Well, and again, I'm assuming, yes, you're new to this world because you're still in your healing phase. And so most people, when you have a new ostomy, you're not thinking about sex in the beginning, excuse me, at all. you need time to heal. And you're probably looking at a good 2 to 3 months before you're considering approaching that. If you're a permanent, again, 2 to 3 months, before you're going to feel comfortable approaching that. Yeah, yeah, that's normal if you're new. Absolutely.
Well, she
Best
says
thing on your mind.
she's a little older, so that's why she's not interested.
Oh, and that's fine too. That's absolutely fine. And we do have other topics for whoever asked that question. Each month we choose a different topic. Next month for February, I'd like to, somebody had suggested at a previous webinar that we talk about mental health and changes in the mind with ostomies. And I have an ostomy myself, so even though I'm a nurse and I have 20 years experience with ostomies, when you have one, it's different. So living it makes it, not that it makes it real, but it's a whole nother slew of feelings and challenges when you're actually the one that has the ostomy. So I think that's the subject we're going to choose for next month. No more questions, Linda?
I don't see any. Okay, I do have one here. The problem, this is from Patty again. The problem she's having is getting her barriers to seal. She says, no matter what I try, it just never holds. I have a lot of diarrhea, so maybe that's the issue.
So I'm assuming you have an ileostomy, because that's the type of output that comes with ileostomies. And a couple of things come to mind. So when you're cleaning your skin, use just water, don't use soap. Don't use any of the pre-moistened wipes, because a lot of times there's moisture in those. So, and that will hinder the application or the adhesion of your new pouching system. You do want to make sure the area is good and dry. If you do have an ileostomy, I would suggest Coloplast's protective seal that works as caulking. And it's great because it can absorb some moisture into it. If you're, I don't know which product you're using, but if you're using Coloplast's product, switch to Hollister, see if that works better for you, or to Convatec. Sometimes people's body chemistry works a little bit better with different manufacturers and the type of material that their barriers are made of. If you are very watery, there are gelling agents that you could put into the pouch each time you open it or empty it. That will help thicken that output. So leakage is more common for watery output. So if you thicken it, that might decrease your chances of leakage. And the other option I would consider is an ostomy belt. So that holds your pouch closer to your body. You do want to wear these ostomy belts snug so that it holds it nice and tight. That reduces your risk for leakage. And the last thing you probably want to consider is, does your stoma protrude from the skin? Is it everted? That's the term we use in clinical. If it protrudes, you can use a flat barrier. But if it's flush with the skin or only protrudes slightly, you may want to consider going to convexity. So that convexity is a cupped barrier. So it puts a little extra pressure on the skin right around the stoma. And that helps it to pop out a little bit. So that may be an option for you as well.
She says, yes, it protrudes. It has a very large hernia under it. She has a loop colostomy right now. We'll be having it made permanent in about a month or so. And she has C. diff.
Oh, so if you have C. diff, I'm sure you're on antibiotics. You do not want to be taking Imodium when you have C. diff, that diarrhea. That's how your body sheds that toxin. So the antibiotics should be helping. If you've been on antibiotics for 4 or 5 days a week, consider calling your doctor because you may need to be on a different antibiotic. Maybe it's not responding. And again, I do worry about dehydration when you're going that often from C. diff. So you should be drinking fluids like Pedialyte, Gatorade, eating bananas. Make sure you're getting things that have salt in it and potassium because you can dehydrate very quickly.
We did have a question about, but you did answer it. I'm not sure if Lenora was asking the question, and I'm not sure if she made it in time to hear your answer. I don't know if she came in later, but it was her output is so watery. What can I take to thicken it?
So foods that naturally thicken the stool without adding fiber. I mean, of course, you can take fiber, which will help as well. And Lenora, I'm not sure if you're the one with the C. diff, but if you don't have the C. diff, your options are a little bit different. So foods that thicken the stool are going to be your carbs. So things like potatoes, rice, pasta, bananas, peanut butter. And your potatoes actually can be in any form, whether they're potato chips, boiled potatoes, baked potatoes, mashed potatoes. I do have a patient that puts banana flakes in things. He says that works great for thickening his ostomy output. Things like your breads and your bagels, those are certainly good choices to help thicken things up. If you have an ileostomy, and I apologize, Lenora, I don't remember for you. There's other things. If you don't have C. diff, you could take Imodium. That will help thicken things. It will allow that waste to move slower through your intestinal tract, so that your body can hold on to that fluid a little more. There's also some medications such as Colistid or cholestyramine that are appropriate for high output ileostomies. And that's a medication that will absorb fluid in your digestive tract. It also absorbs bile salts. So depending on the type of surgery that you had, that could be a reason why you have diarrhea. But those are things that need to be recommended by your surgeon or your doctor, your GI doctor. Those might be options for you.
I have a question from Maren. She asks, are probiotics okay to take with ostomies, especially if taking antibiotics?
Absolutely. Absolutely. So just because you have a colostomy doesn't mean you can't suffer from things like constipation, diarrhea, you eat something, odd or, whatever. Those same things. You can have bouts of diarrhea with a colostomy for any number of reasons. But you can be constipated. So if you need stool softeners, take them. If you need fiber, take it. If you need probiotics, take it. And actually, probiotics may help thicken things for you as well. So if you happen to have some looser stool, probiotics are a good choice to try.
Well, Patty's writing that she's been very ill, in and out of the hospital, 3 surgeries since October. She's on an IV at home because of dehydration, and C. diff was just diagnosed, but she's only into it about 3 days. But she's had it a long time because of the symptoms that she's read about, and the doctor's talking about hospitalizing her again. So she's going through a lot.
Sure, and that is very difficult. But as much as you don't want to be in the hospital, sometimes that's the perfect place to be. So you're home with IVs, that's a lot. You're going to get through this bout of C. diff, so it won't always be this way. But don't be afraid to be in the hospital. They can keep your electrolytes where they need to be, keeping you hydrated. I don't want you to be afraid to have to go back to the hospital. That's important. If you've been this sick for this long, I'm sure you've actually lost quite a bit of weight. And hopefully you're eating Patty, because, you know, I know sometimes that's hard as well. And some people end up needing IV nutrition because they just can't um, get enough calories in to sustain. They're going through your system much too quickly for you to be able to have the benefit of the calories and the nutrition. So I'm sorry to hear that you're going through that, Patty. I do wish you well.
Lenora's writes, she had an
Ileostomy.
ileostomy, but she's tried potatoes, but everything still comes out watery. And should she try to have blood work to see if she's getting enough nutrition? She empties her pouch about 12 times a day.
So Lenore, what I would recommend is get yourself some type of measuring device. So, you know, like well, we have graduates, they're disposable, but get yourself some type of measuring device. And every time you empty your pouch, empty it into the measuring device, and then you can dump it. But I want you to write down how many cc's or milliliters you're emptying. So in order for you not to be dehydrated, you should be getting less than 1,500 cc's or 1,500 milliliters in a 24-hour period. So if you are consistently at 1,500 cc's, I worry about your hydration status. If you're hovering around 1,200, 1,300, I think you're going to be okay. But the way for you to know whether or not you're dehydrated is your mouth dry and your lips dry? Is your skin, like when you pinch the skin on your hand and pull it up, if it stays in that position, that's called skin turgor. If it stays that way, that means you're low on fluid. Other things, are you urinating okay? Is your urine light yellow or is it dark? Those are signs of dehydration. So if you're finding any of those symptoms, call your doctor. I would have blood work done so they can check your electrolytes and make sure that you're where you need to be. So with the ileostomy, are you taking Imodium? That's important. Most often you can take, I have patients taking one Imodium 3 to 4 times a day. So you want to spread it out first thing in the morning, maybe lunchtime, dinner time, and bedtime. And then if that's not working, maybe you can add fiber. When you eat fiber with an ileostomy, the fiber package says to drink with an 8-ounce glass of water, but you don't want to do that. So you want to take the fiber with a small sip, hold any fluid intake for about 30 minutes. What that does is allow the fiber to absorb the fluid that's already in your digestive tract to help thicken things up for you. So you could, in conjunction, use Imodium and fiber. And I tell patients, if you're going to do the fiber and you have an ileostomy, you may need to take fiber 2 to 3 times a day. So keep that in mind because things travel through so quickly. You need to constantly be replenishing that. And if those don't work for you, Lenore, then you should call your doctor, because there's other prescription medications like the Colistid and Lamodal, which is a little more effective than the Imodium, but they require prescriptions.
He says, thank you.
Oh, you're welcome.
And Patty says she's ready for full bed rest and being waited on at the hospital. Actually sounds like a break.
I think you should do it, Patty, because it is a lot of work for you to be home and going through all of this. Very much.
Patty says Pepto-Bismol stops watery diarrhea, but it turns stool black. Her GI doctor told her that.
Yes, it does. It does. And I find Imodium a little more effective than Pepto. But if it's working for you, great. Back in my day, I'm dating myself, there used to be a product called Kaopectate. I don't even know if that's still on the market. I can't say that I've seen it on the shelves, but then again, I haven't been looking for it, so.
Patty says it is.
Oh, it is. Oh, thank you.
And so does Lenore has seen it too.
Oh, good. That's what we had when I was a kid. So I'm glad we had the ability to talk about other things other than intimacy. So I'm happy that I could help all you guys.
There's an anonymous attendee that wants to know, what do you recommend for swimming?
Swimming, great topic. So if you're using a product that's got a gauzy tape barrier like Compitech or Hollister, excuse me, there are products that you can put on the outer edges, something called a Shore Seal Ring, or elastic barrier strips that will waterproof pretty much that tape border. Although you don't have to do that, you can swim with your pouch. They're meant to stay intact. But my thought is, if you've worn a cloth Band-Aid on your finger and you wash your hands, it kind of feels loosey-goosey. So you might feel better having something a little more secure. There's there's a few products out there. I'm trying to think of the name of it, for swimming. And it's a product that you put right around your abdomen and you pump it, it blows air in. So it kind of seals it so that when you swim, it keeps your pouch dry. So that's an option. Stealth Belt makes a product called, that's actually for scuba diving and swimming. It's made of Gore-Tex. It's a little expensive, but if you're somebody who enjoys swimming, you really might like that. I would recommend before you swim, empty your pouch. If you have a pouch with a filter, you want to put the little sticker that comes in the box over the filter, so that will protect your filter. What else? Consider it, if you are swimming, check your pouch after your encounter of swimming and just make sure it's intact. These pouches, they do dry rather quickly. Hair dryer on a low setting. You can towel it so that it's only slightly damp. That will help it dry a little bit quicker. What else can we do? Those are probably your best options for swimming.
Patty has a tip. She says eating marshmallows helps stop things up for an hour or so. She learned that at another support site, and she says it works.
It
True.
does. It does. So for those with ileostomies, I do recommend that, as long as you're not diabetic, if you eat 3 regular sized marshmallows about 5 minutes before you're changing your pouch, 5 to 10 minutes, there's something in that gumminess that will slow that flow. It might not stop it completely, but it slows it enough for you to be able to get your pouch off, clean the area, get your pouch back on. So, yep, it's a great trick.
Patty says she did it so she could go in the hot tub.
Great. That is awesome. Enjoy that hot tub.
Sounds good right about now, doesn't it?
But yeah, with the cold weather we have.
Right?
So Linda, you're learning a lot about ostomies, huh?
Oh, yes. A lot. Yep. I've had quite the education since I've come to HPFY. So Lenora says that for the first time since the stoma, she ate an orange today and now it's hurting coming out.
So, and that could be for, well, for 2 reasons. The first one is oranges are acidic. So you can have some burning from acidic food. So that would be the first thing. You could try taking an antacid to help buffer something like that. But the other thing is hopefully your ostomy is functioning. Sometimes the pulp portion of citrus fruits like grapefruits and oranges can clog or not clog, but limit that output. So you can get obstructed from it or a partial obstruction. So you do want to be careful with those types of foods if you have an ileostomy. Yeah, maybe oranges are not for you. And other foods that can do that, by the way, are things like Chinese vegetables, because they're al dente, are crisp, coleslaw, corn, anything that's stringy. So you have to be careful with casings of sausages or hot dogs. Those can really ball up and create obstructive symptoms. So if you're having cramping and no output, that it can pass, and often it will in a couple of hours. But if you're too uncomfortable or having too much pain, your stoma can be flushed via a small catheter that they can put into the stoma and irrigate it.
Well, Patty says thank you. She enjoyed it. She needs to go. So thank you so much, Patty.
Thanks for coming and attending, Patty, and I'm happy to help. All right, so I think we can wrap it up. Again, if anybody has questions as we end this, feel free to send an email. I typically, I've reduced to the hours that I'm spending, but I typically am on and answering questions on Mondays and Tuesday evenings. And I do check my emails throughout the rest of the week periodically. So I don't have any set times, but feel free to send me an email and I'll be happy to answer your questions.
You're welcome, Maren. Maren is thanking you for the great presentation. She learned a lot, she said.
Oh, good. I'm glad. You're welcome, Maren. All right, so next month's topic, again, I think we'll approach and discuss mental changes and thoughts and coping mechanisms with new stomas. And I hope to see you next month. Thank you again.